Hi coders, I wanted to jump in for a couple of minutes as we look into the very complex chapter on evaluation and management. This is probably the most confusing chapter in all of your CPT coding because it involves making a decision as to what factors are represented in the specific codes. And what we're looking at is one of the top PowerPoint slides. And incidentally, I do want you to go through these PowerPoint slides because they're very, very helpful. And they're giving you the basics of your textbook. So after you read your book, go through the PowerPoint slides so that you can review what you have read, because understanding evaluation and management is vital to being able to go on with the rest of the services that might have been provided for the patient. So I'm going to skip through here as much as I can because there's a lot of slides to look at. I think there's 80 some slides. So let me see what else. What I'm looking for is the slide that talks about the levels of service, because you have to choose the three components, and we're not going to look at this one, the patient type. What I've done while I'm scrolling through here and trying to find what I just had a second ago is I have uploaded some pages out of the actual CPT paper manual so that you can have it with you as you go through your coding. And the first thing to look at is your table of risk. And your table of risk is going to help you decide what code to choose. And I think it's in I found this in the slide number 80 or something like that. The actual codes, the medical decision-making rubric is there. So the table of risk is a good one if you can print it out and keep it with you after you finish the chapter. And of course, decide whether this is something that you absolutely need to have. Because some of you may just pick it up really, really quickly and not mind going into the Speedy Coder. But anyway, the evaluation and management goes through all the different types of services that are mentioned in these slides. And then the second part of it, on what starts on page 168, gives you the crosswalk of how to decide new patient, established patient. So I thought that would be helpful for you also. It's called, once again, the Medicare crosswalk. So now let's go back to finding the components. This is the one I was looking for. It's three components: the history, the examination, and medical decision making. So in evaluation and management, we're paying for the amount of time that the provider is in front of the patient, how serious the history is, and as you read in your book, the history is basically subjective, that the patient is telling the provider what happened, and the provider asks questions about location and intensity and tries to get as much information on the patient as possible. And actually the history and a good physician will begin the minute the physician walks in the exam room door and looks at the patient, because the color of the skin, whether the eyes look normal, just the whole bearing of the person is important in the examination, and the history begins there. And then the examination is obviously what the physician provides to find out what is going on. And then once the examination is complete, or assumed, should I say, that it's time to make some medical decision making, and it might be, I need more information. I want your blood drawn. I want some x-rays. So the amount of time and expertise that a doctor is required to use in examining the patient is going to determine how high a level of service is going to be billed, if that makes sense to you. I'm going to skip over this one. This is what I just discussed. The history subjective, and chief complaint is really important. And chief complaint, if there's going to be multiple codes associated with services, the chief complaint is the most important. And you remember that from studying your ICD. It's the reason the person sought treatment. And then anything else would be, as you remember, the underlying is there something that's going to exacerbate the treatment of this patient? So the history is important. And then this talks a little bit about the examination and the 7 body areas. And I've also attached the GG guide in what I uploaded in this chapter. So I have 3 different attachments there for you to look at. And hopefully that's going to be helpful. Other key components are how much I mentioned time, coordination of care. There can be the physician, when he leaves the exam room, can spend some additional time, not face-to-face with the person, as you can see, arranging referrals. And the nature of the presenting illness is going to determine the morbidity or mortality, how sick the person is, or whether the person has the type of an illness that can quickly lead to death. So here's an example, and again, go through these slides slowly so that you have plenty of time to digest them. And then look at this particular slide, the summary of key components and contributory factors to help you decide. And this may be a little easier for you than the ones that I gave you. But I'm going to skip to the levels, which is going to up the code. How serious was the history? What level of examination? So basically, if it's a problem-focused exam, let's say a person comes in for an earache, and the doctor looks at the ear and prescribes and says, oh, your eardrum is bulging, let's give you, here's some medication. It's pretty simple. Expanded focus means that there's going to be a little bit, maybe another area looked at, such as you have an earache and you have a cough, so you're looking at the ears, and then you're listening to the chest and checking to see if there are any rows, etc., and so forth. So all of this amounts to how much time. And then the patient's age, a very, very young or very, very old person, is going to change the level of service. So I have a few minutes left on this, and let's see what I can point out quickly. Your key component tool, you have this on page, well, you're in the first edition. On the second edition, it's on page 514, but the same chart is going to be in your book. So that should be helpful for you. And let's get down to the history levels. This chart is very, very helpful because you can see brief. You only look at one element. And notice when the location, the severity, the timing, modifying factors, what makes it better, what makes it worse is what we're talking about in modifying factors. The quality, I'm sure you've been asked, is the pain on a scale of 1 to 10? What is your pain level? And 10 is the most intense pain. The duration, how long has it been going on? And that's a really difficult question to ask of a person, because you may notice something is going on but kind of ignore it, and the typical patient doesn't pick up immediately on what is going on. But so the duration is important. And the context, it started when I was walking down the street or I was jogging, and I noticed my back felt funny. And what are the associated signs and symptoms? And using this example of the back, well, I kind of feel pain going down my leg or numbness in my feet, with the back analogy. And then the review of systems, the constitutional, checking your body, allergies, CVENT, etc., and so forth. So remember, the more systems that have to be taken into consideration, the more complex the decision making is. So looking over here, history and physical, we have 4 elements or 3 chronic problems. And in the review of systems, 10 systems can be looked at to determine the history of the illness and the level of medical decision making. So then sometimes we need to know about your past history, your family history, and I'm sure that you've had the experience of going into having to fill out yet another patient information form because it's been a year since you've been in, and they want everything updated. And so this is going to relate to, well, my parents both had a history of diabetes, and so that's going to be important to include in the history and in the provider's thinking about, could this possibly are the symptoms related to diabetes, or high blood pressure is probably an easier one to say, because high blood pressure is easier to recognize than diabetes. And we've talked before about established versus a subsequent patient. And this chart is helpful, the location, the quality, and I think that I've gone over that with you. So I'm just going to check quickly and see if there's anything else that I wanted to talk about. I've attached the 1997 DG, and I think that is in that particular guide. Anyway, I'm running out of time, so I hope this is helpful to get you started in evaluation and management. Take your time and make sure that you thoroughly understand what you're reading in your chapter, so that you will conquer the most important and the most intensive and extensive part of your coding experience. So if you have any questions, get in touch with me, and I'm hoping that you're enjoying this class.